right, good morning, gang. I wanted to hop on. I'm going to do a quick little video. I'm going to do this actually in two parts. So part one is going to be going over all of our supplies that we currently use for our equipment and how often we're going to be changing them out and what is going to be that process for our new updates that we made to our policies. So I have posted these to the huddle board over the last week and a half. So if you haven't had a chance to review these yet, please snag them. They're still within the approval process in policy text, so you won't see them in there yet, but you can review the drafts and see what modifications and changes we've made so far to, again, the new processes for changing out our equipment. So I want to briefly kind of go over what that's going to look like, and then in part two, I'll do a separate video on what will be the documentation requirements for these processes. So as you are familiar with, all of our circuits are Fisher and Paykel circuits aside from our dry NIB circuit. And per the manufacturer recommendations from Fisher and Paykel, all of the circuits should be changed out every 7 days. So if, for instance, today's a Tuesday, 3/7, I would note that this circuit needs to be changed in 7 days on 3/14, which would be next Tuesday. And what I would do is within the circuit, you're going to see this little yellow tool that's in here that has the days of the week and they're yellow. Take this out with you when you're initiating BiPAP or ventilation, and you're going to place the sticker visibly on the side of your heater pot once you set it up. The only thing with the stickers is it'll say change on Sunday. So if I'm setting it up like I said for today, for next Tuesday, I would pick the change on Tuesday sticker, but then I'm gonna need to take a Sharpie and I'm gonna need to write on there 3/14/23. That way I don't walk in the room and say, oh, is that this Sunday, next Sunday, this Tuesday, next Tuesday? You get the point. So we're gonna do that for all of our circuits, whether it's the BiPAP, high flow, or ventilator circuits. Every 7 days, utilize the yellow sticker, place it visibly on the pot so people can see when it's due, write with a black Sharpie the date that it's due to coincide with the date of the week. Okay? All right, and then the other thing that we have is going to be our closed system suction catheter, or our Ballards. These are going to be changed every 72 hours for the manufacturer. So they also come with some handy dandy little labels within the package, and they also have the day of the week on there. So you're going to go ahead and pick the day that it's due for that week. So today again is Tuesday. 72 hours from now we have 24, 48, 72 would be Friday. I'm going to place this pink Friday sticker visibly on the actual closed suction system itself. I typically do it kind of right at the head there before it connects to the artificial airway, and that way the person that's following you can see that it's due this Friday. This one you won't have room to put the date on there, but it should obviously fall sometime within that week. So that's, since it's only 72 hours. So that should tell you when it should be changed, okay? All right, and then lastly, we have our small volume nebulizers. We have our band, and then we have our Misty Neb. Both of these are gonna be changed out every 7 days per manufacturer recommendations. And I did fail to mention that the Ballard, this is gonna be changed on day shift. So when you're performing your oral care at 0700 or your first rounds, you're gonna change out the Ballard then on day shift. And then our circuits are gonna be changed on night shift, okay? So it's important to note. And then in part two, we'll talk about how we can kind of help support each other with reminding each other of that. So the nebulizers are also gonna be changed out on day shift, okay? Every 7 days. And the process for this is we're just gonna have the patient set up bag like we do currently, hanging from one of the flow meters. We're gonna put the patient's name on here in the black Sharpie, and then we're gonna put the date that it's due to be changed. So again, if I were starting this today, I would put on here 3/14/23 for 7 days from now when the nebulizer would be changed. When I go to change it, the bag gets tossed and I get a new bag and I get a new nebulizer, a whole new kit, okay? As far as the cleaning process between each use, so if I'm seeing a patient QID and I see them at 7 in the morning and I give them their first treatment, I'm gonna make sure that I'm discarding all of the excess medication within the cups so that it can dry as best as possible. And then I'm going to put it back in the patient setup bag with a clean paper towel to try to absorb some of that moisture that gets collected inside the bag. I'm going to do that each time that I go and see the patient. If, however, you're running really viscous medications in here, you have muco or bicarb, something that gets kind of sticky, then you are going to want to use a saline bullet or grab one of the normal saline bottles. Rinse this out in the sink to kind of clean and discard any of that sticky medication within the neb cup, and then let the parts air dry, and then again stick it back in the patient bag with a clean paper towel.